Hi everyone, I'm Sherry Worsham. Tonight's topic is attention control in ADHD. The article information is associated with this YouTube video, so look on that site. The researchers were Sarver, Rapport, Kofler, Raiker, and Friedman. The title of their research is Hyperactivity in Attention Deficit Hyperactivity Disorder, Impairing Deficit or Compensatory Behavior. These researchers sought to find out to what extent are gross motor movements, which is sometimes called hyperactivity, associated with working memory performance and attention control in children with ADHD relative to typically developing children. Gross motor movement is important for us to understand developmentally. Babies and the very young need gross motor movement to explore their world, to develop inquisitiveness, to foster social interactions, to help with supporting mental acuity. But by the age of 4 or 5, a child needs to be able to control their gross motor movements. A parent report of a child that at the age of 4 that cannot regulate their gross motor movement is associated with a clinical diagnosis of ADHD by the time the child is at age 9. And ADHD is associated with negative outcomes, including aggression, oppositional behaviors, parent and peer relationship problems. ADHD can set a child up for a lifetime of functional impairment. It's important that we understand the components of it. These researchers tried to do just that. They had an impressive procedure in place with a comprehensive screening using full-scale IQ, parent and teacher report, clinical interview, and a diagnosis of ADHD based on the DSM-4 criteria. From this process, they had 52 participants. All of them were boys. They were aged 8 to 12. 29 of the children were diagnosed with ADHD, and 23 of the children were considered to be typically developing. Now, the variables or factors that were examined included activity, attention, and phonological working memory, not the visual spatial working memory, just the phonological one. These researchers had cameras that were able to continuously record by video and audio all of the movements and actions that were taking place with these children. The examiners were trained, and they were able to then quantify the movements and everything that they saw on the video and audio recordings. There was a strict inter-rater reliability check so that the data was objective and not subjective. So much of ADHD research can sometimes be based on subjective ratings. So that meant that this was a very important study. So the children were in chairs that had the roller caster balls or wheels. And everything that they did, from swinging or spinning or tilting back and forth, their foot movements out of the seat, every bit of that was examined and linked to the attention part that was also being recorded. Attention was determined by the orientation of the child's head to the computer screen. If the child's head was 45 degrees tilted away from the screen, that was considered off task and not paying attention. Then the phonological working memory was assessed using a subpart of the WISC for cognitive evaluation. This subpart was the letter number sequencing task that's based on Baddeley's model for working memory. Now, after all of the data was quantified, the researchers were able to explain, look in the article, the results. And the results were pretty impressive. First of all, 48% of the children that were diagnosed with ADHD showed significant improvement in their working memory performance when they were the most active. Now, the opposite was true for children who were typically developing. So the children who were diagnosed with ADHD did better whenever they were the most active, but typically developing children didn't do better in that case. In fact, there was a 41% greater increase in working memory performance at the highest level of activity compared to the lower levels of activity in the children with attention deficit disorder diagnosis. Now, this study and the results support finding that gross motor activity or hyperactivity is a compensatory behavior. Children might exhibit these hyperactive behaviors or excessive gross motor movements when they are faced with challenging tasks and it aids them in controlling their attention. Now, gross motor activity is also linked to arousal of the central nervous system, and because the prefrontal cortical area of the brain in attention deficit disorder children tends to be hypoactive. So the thought is that the actions and the activity of these children arouses them and allows them to pay better attention or to have better control of their attention. This is very important, especially for the academic world or in clinical settings, and to help us understand and plan for how to best help children diagnosed with ADHD. Thank you. I hope you enjoyed the article.